Hi, welcome to this webinar about communication partner training. In this session, we are going to focus on how we train other people to be good communication partners for our AAC users. My name is Jessica Broderick. I'm a speech-language pathologist and assistive technology specialist in Western Nebraska. And thank you to the Nebraska Assistive Technology Partnership for the opportunity to share this information with you. In this webinar series, we are focusing on how we go from our AAC users being present in a classroom to being competitors, whether that's competitive in their classroom, competitive in their curriculum, competitive on a job site, job skills, or just in the community in life, whatever way is most important for them. So we're going to talk about three things in this webinar. First, we're going to talk about the different types of communication partners. So there are a few different types that we'll define. Then I will talk to you about what strategies we might want to train those partners on, and then an 8-step process for how you can go about doing that. That's based in research and has been shown to be effective. Okay, first up, types of communication partners. So there are three types of communication partners I'm going to cover. The first is familiar communication partners. So these are people who are very familiar with the person who uses AAC. So this might be somebody like family members, might be best friend, might be aunt, uncle, somebody that is used to the individual, knows how they communicate. There is an AAC users report where researchers interviewed various AAC users and asked what are the qualities of a good familiar partner. So what do familiar partners do that make them a positive communication partner? And so these are some of the things that they listed as being really important if you were familiar communication partner. One was patience. To really listen, patience, as the person figures out the system, patience knowing that this form of communication might take them a little bit longer than verbal language, spending time with the person, knowing how to ask clarifying questions, maybe if that message wasn't clear, rather than just not asking or feeling awkward asking if that communication wasn't clear. Knows about all of the person's communication modes and accepts them. So, you might have AAC users who have a high-tech device, who also use low-tech sometime, who use some sign, and have a few verbal words that they use. So this person is familiar with all of those communication modes and is okay with all of them. These people have high expectations for the communicator, and they know about the AAC system and how to incorporate it into activities. So they purposefully set things up or create activities or find ways that the person can be included. The second type of communication partner is an unfamiliar communication partner. So this is anybody who doesn't interact with that user on a regular basis. So for this, we're thinking maybe a store clerk, maybe a new manager at a job site, maybe somebody at the post office, those kinds of people. So again, in surveying AAC users, here are some positive qualities for an unfamiliar partner. Would be that they are willing to listen to a brief explanation of the person using the system. So whether that is a facilitator, like a teacher, an SLP, or a parent saying, this person communicates using this tablet, and so they need a little bit more time, or whether that's the AAC user themselves saying, I need more time, I communicate differently. So somebody that was willing to listen to a brief explanation. This is somebody who has been given information about good communication partner behaviors, which is something kind of what we're going to talk about today is how do we give that information and make it meaningful. So as part of that explanation in the first one, maybe something that I have said is give us a little more wait time than maybe a person you would typically interact with. So this person has been given some information about the things that they need to do to be a good communication partner. And they also accept and understand the role of the facilitator. So that might be, you know, your SLP, your teacher, your parent, that this person is there to help the user communicate, but is not there to speak for them. So they understand that kind of dichotomy, which kind of leads me to the next communication partner is the facilitator. So this is a paid person who is supporting the student in learning AAC or improving their use of AAC. So this is like your SLP or your teacher. Positive qualities for this person is that they are able to train other facilitators and the AAC user, which is kind of what we're talking about today. So, you know, I as the SLP would be able to train the new special education teacher. Maybe I'm training some paras, maybe I'm training the students on a job experience and I'm working with the supervisor or the boss or something like that. So this person is able to train others. I can, if I'm the facilitator, I can provide information about the person and the system. So I'm familiar with both the person and their communication and the system. So I'm there to give information, answer questions, and troubleshoot. The facilitator communication partner structures the environment to support communication. So maybe that's positioning in a way that allows access. Maybe I know how to operate the device. I've set up some activities that I know will elicit communication or that the user really likes and has the opportunity to want to communicate about that. I'm providing varied and meaningful opportunities for communication. So a lot of different environments and activities and projects. I'm making sure that they're involved in whatever we're doing and it's motivating for them, prompting only when necessary. So in the modeling webinar that's part of this series, I go over prompting and a prompt hierarchy so that if you're interested in more information about that, I'd encourage you to check that out. And then models, the AAC technique. So this is somebody who is comfortable with modeling. Again, different webinar on the concept of modeling. So they can use that modeling and are comfortable with it. Okay, so we know, we just heard from AAC users that somebody who knows how to train others is an important role of the facilitator. So if you are watching this, I am guessing that you are some kind of facilitator or familiar communication partner. So maybe you're your parent, maybe you're a best friend, maybe you're the teacher, the SLP, maybe a para, whoever you are. This is geared towards you. You will be training others in how to also be good communication partners. So you yourself are a good communication partner, and now you're going to train other people to also be good communication partners. So here are some strategies that you might want to start with. These are just suggestions, things that you want to be teaching other people who are interacting with this AAC user. So using an extended wait time, an expectant pause or delay, making sure that you're making eye contact with the AAC user and looking at them and not their device and treating them like they are communicating to you rather than focusing on the device itself. How to respond to all communication attempts, how to use open-ended questions to kind of support that communication, how to model, and then the use of aided language stimulation. And then again, those last two, modeling and that aided language stimulation, are in another webinar about modeling if you need more information about those. So Kent Walsh and McNaughton came up with this 8-stage communication partner instruction structure, I guess you could say. So this is a method that others, to teach others to apply these strategies that I just showed you, going through 8 pretty set up, pretty direct steps to encourage others to be good communication partners. So we are going to roll through those. So step 1, this is a pre-test and commitment. So what you're doing in step 1 is you have picked a target. So I'm just gonna use an example. So I, as an SLP, one of the people that I might be training is a new paraprofessional that's working with this student. So I know who the target is, and I'm working with that person. So I'm going to just observe their interaction with that AAC user in a natural environment and just see. I'm just going to do some observations. I'm going to know what strategy. Also, not only have I picked my person, but I've picked my strategy. For this example, I'm picking wait time, so that we're focusing on using an extended wait time to give that student the opportunity to communicate. So I've done an observation. I know who I'm looking at. I know what I'm looking for. So I'm going to do that observation, and then I'm going to talk to that person afterwards and tell them what I was looking for. So I might say, when I was observing you with Johnny, the strategy I want to work with you on first is using wait time. And that's what that is. It means giving them extra time than you normally would. Sometimes it's kind of awkward, however I'm explaining that strategy. Then I'm going to talk about that observation, what I saw that went well, and some things that I think we can grow in. And then I'm kind of going to see how committed that person is to participating in this. So hopefully they say, yeah, I want Johnny to succeed. I want him to communicate with me. That would be great. I'd love to work with you more on this. But we need to have their commitment and their desire to also participate in this program, because it's really a back and forth kind of thing. So stage 2 is, so I'm going to tell them in stage 2 more about the strategy. So I'm going to teach components of that skill using direct instruction. So I'm going to be very direct in like, this is what wait time looks like. It means that I am attending to the person. I am looking at them. I am expectantly waiting, and I'm going to give them at least 10 seconds to start to initiate a response. 10 seconds, 15, whatever your user needs. So I'm going to go through directly instructing that adult, or maybe it's a friend, but in my case, an adult, that para, in that strategy. I'm going to tell them what it looks like. I'm going to give them, little ways to remember that. So wait time, I think of mind your body. So you have 10 seconds in your head that you're counting, your body's leaned forward, and your eyes are looking at the person. I have a meme on here because, visuals are always a fun way to help people remember things or to talk about things. And so I'm going to explain all that, and then I'm also going to explain what the impact is. Like if we do this, a lot of times Johnny just needs a little bit of extra time because he has a processing delay. And so if we give him that extra time, I've seen him come up with some really awesome communication things, or he knows how to ask for help if he's not understanding. So teach the skill and then explain why it's important. That is step 2. Step 3 is to demonstrate. So I'm going to model the strategy and explain it as I go. So for wait time, this is a really easy example, but you can also use this, in teaching somebody to program a device or to find new vocabulary or to how to model. So things that might be a little more involved, but wait time is easy for the purpose of a webinar. So I would be working with that person, and I'm just going to model what it looks like and what my expectations are as I'm explaining it. You might do a task analysis for it, so you can look at all of the steps that you're watching for the person to do. And depending on your AAC user, this step and the next few ones might involve them or it might not. So if that student is comfortable with being a part of this adult learning, that's great. If they're not able to communicate with you that they are, or that they understand that this is about the adult learning, then I wouldn't. I would just practice with a few other adults. But if that student is able to give consent and is interested in, yeah, I want Mrs. Johnson to get better at this too, let's do it, then I would absolutely involve the student if they're okay with that. Stage 4, we've modeled it, we've talked about it, and we're just going to review it. And then at this point, that communication partner, so my para, is going to start telling those steps back to me or explaining it back to me. So at this point, I'm checking for his or her understanding. And so that is step 4. In step 5, we're doing some controlled practice. So this is a controlled environment. In my small therapy session, maybe it's just myself and the para and another person, or maybe the student if the student's working with us. So that partner is practicing, implementing whatever strategy you've taught them. And I, as the instructor, am going to gradually decrease the instruction and the prompting and the feedback I'm giving them, so they can increase their independence. Again, if you're thinking about wait time, that's a pretty easy one. But if you're thinking about how to program a new button on a high-tech device, that can be a little trickier. Stage 6 is advanced practice and feedback. So now we've done our controlled practice. I feel like it's going okay. I feel like they've got it. And now that person is going to practice whatever we're working on many times across different environments. So at this point, they're kind of working with the student, and I'm observing, in the classroom, in the therapy room, in the lunchroom, wherever that's happening across environments. And I, again, am just going to gradually reduce any feedback that I'm giving to increase the independence of the communication partner. Stage 7 is the post-test and commitment to long-term use. So I'm feeling like this person has got this. They've got it figured out. It's going well. I think they're ready. So whatever documentation system I'm using, I'm going to document that, yeah, we talked about this. They've got it. Compare, what they've learned, and talk to them about what they've learned. And, when I first did that observation, you were kind of like just 2 seconds, you were asking Johnny another question. And now when I see you interact with him, you're giving him that 10 seconds. I see you looking expectantly, and compare that to where the person started and where they are now. And then get their own feedback to continue to get that buy-in. How did you see Johnny's interactions with you change when you were using this strategy? And make sure that they're sharing their perception of the situation with you as well. And then come up together with a plan of action to generalize that across all interactions that person's having. Finally, stage 8, generalization. So that person has learned the strategy. We are good to go. They implement it. They're committed to implementing it, and they are efficient with it. They can do it any setting, different AAC users, and different partners, whatever the situation is. So at that point, you are done with that strategy, and then you pick your next one. So it's always nice to keep a revolving door of continuing to train new communication partners, or train familiar communication partners in new skills. So we continue to get those partners to where we want to be good facilitators of language. I just kind of have one resource for you in this webinar, and that is this strategy flipbook. And it's just a reminder to kind of keep things, give visuals whenever possible. Just a visual cue, even for adults, is super helpful. So to use some things like this, so you might make a flip book as part of your training, or use memes or do some other kinds of stuff. I just like this one. This is from Practical AAC. It's just an AAC 101 handout, and you can print it, put it on different colored paper, and make a little booklet. So that might be a different way to work through things, or to pick strategies, or give just a visual reminder to those communication partners you're training. And that is it for this webinar. So thank you for joining me. If you have any questions or want to have any more discussion about this, I would encourage you to email me at jessica.sorpt@gmail.com. And I hope this information leads you to training more and more people to be good communication partners for our AAC users. Thank you.
Thank you for watching this webinar. For more information on the ATP Education Program, please visit our website at atp.nebraska.gov or email us at atp.education@nebraska.gov.